Hi guys, let's talk about Stridor, the abnormal breath sound you never want to hear. Well, it is a very common breath sound among your pediatric patients, and they are presented with harsh, high-pitched breathing, which is due to obstruction of their upper airways. So you can imagine that it is a priority. It occurs most commonly in anaphylaxis, epiglottitis, and aspiration of foreign object. We're going to include a little soundtrack so that you can understand how Stridor feels like whenever you come across patients with any of these diseases. And whenever you see this word in your nclex questions, the first thing you want to do is notify the HCP ASAP. That's all about Stridor. Thank you.